The Executive Director of the National Primary Healthcare Development Agency, NPHCDA, Dr. Faisal Shuaib, says COVID-19 vaccines have been deployed and states will start receiving them today. Shuaib disclosed this at the national briefing of the Presidential Task Force on COVID-19 in Abuja. Nigeria on Friday, March 5th, commenced the COVID-19 vaccination, beginning with healthcare workers who are often at the risk of exposure to infections, being the first responders to patients.
The movement of the vaccines to the states has commenced today. All things being equal, the delivery of the vaccines will be completed tomorrow. The delivery of the vaccines to the states is predicated on satisfactorily meeting the conditions to keep them safe and potent. We are designating vaccine accountability officers in the states and local government areas to closely monitor the management and utilization of the vaccines. These vaccine and accountability officers will ensure retrieval of vaccines vials for proper disposal. The post-vaccination disposal process of the vials is equally as important as the vaccination process itself, and we urge states and local governments to keep a close watch on this process. As you may recall, that we officially launched our homegrown TEACH strategy of electronic registration of our citizens for the vaccination program. This is the first time in our immunization program that the target population will be pre-registered for efficient and orderly scheduling of dates and time to receive the vaccine, which will be carried out in phases according to predetermined classifications. All persons 18 years and above, beginning with the frontline health workers and the elderly, are therefore encouraged to register for vaccination through our COVID-19 vaccination e-registration portal, which is available on our website, www.nphcda.gov.ng. In addition, the media and all stakeholders involved in this crucial public health intervention should do all that they can to promote the e-registration under the Electronic Immunization Data Management Scheme, as this structure will be further deployed for further public health interventions. Adequate provision has been made to deploy the COVID-19 vaccines to all states and vaccination sites where people will be vaccinated according to set priorities, beginning with the frontline health workers and other support staff. The state launch of the COVID-19 vaccination for frontline health workers is slated for tomorrow, March the 9th, at the state treatment centers. Barring any prevailing local conditions, most governors have agreed to flag off on March the 10th, while the state rollout of COVID-19 vaccines will commence from the 12th of March. We're working very closely with CACOVID to ensure that these vaccines are airlifted or transported to the states in time for these rollouts. It is expected that the states will roll out vaccination only when local government areas have met the minimum criteria for successful conduct of the campaigns. Parameters such as training, cold chain status, preposition of data tools, availability of transport, logistics for healthcare workers, adequate security for vaccines, etc., should be the yardstick for going ahead with implementation. Permit me once again to reiterate that an accountability mechanism has been activated in collaboration with the security agencies to check any anticipated sharp practices in the system. We also appeal for the continued alliance of civil society organizations in ensuring equity in the deployment of the vaccines to eligible populations, and any inquiry or complaints should be sent to vaccine.accountability@nphcda.gov.ng.